The diagnosis of WHIM syndrome, historically, and I think to the present, most awfully depends upon blood counts. Because a unique feature of this disorder is it's an immunodeficiency syndrome, which causes both lymphocytes and neutrophils to be very low, or so that the total white blood cell count is very low. And there are many other immunodeficiency syndromes, but only a few that involve both neutrophils and lymphocytes, or have this form of immunodeficiency. So blood counts have been the most reliable way to diagnose the condition. Most of the other manifestations are secondary to the immunodeficiency, so they involve infection or the consequence of infection. I don't know of any patients who've ever had this syndrome who didn't have a reduced total white blood cell count with reduction in both neutrophils and lymphocytes. Maybe there's such a patient, but I don't know of any. In our family studies, we didn't find any. The place of genetic testing, though, is up near the front, because if you find this blood finding, I would say that genetic testing is worth doing if the person has any of the classic clinical problems of WHIM syndrome. That is, recurrent bacterial infections, warts, a positive cervical test for HPV. Those would all be reasons to test. Yeah, that's a puzzle. Why people living in the same household, where you might have susceptibility to the same infections, some people have more problems than others. And warts is an easy example. Some patients have more warts than others, and it's not just young having fewer than older, but some people seem to be more susceptible. The problem of hearing loss is also not even in families. And we don't know why. Certainly, having a single mutation in a single gene doesn't tell the whole picture, because our bodies have a whole host of mechanisms for resisting infections. And so we have also a whole host of mechanisms for defense against infections. So it's quite likely that there are adaptations that go on in some people that are better than others. And we have lots of examples of genetic diseases where the same specific genetic mutation doesn't cause the same disease. We're learning more and more about this, because in some diseases, it's not just a mutation in a gene, but it's the specific mutation in that gene that leads to the actual events that happen in a person. So we're still at the front edge of learning to understand genetic diseases. And although it's a great discovery to discover the specific cause, we've still a lot to learn.